Africa carries 24% of the global disease burden, yet receives less than 2% of global research investment. This tax disparities shows that Africa's health priorities are underfunded, leaving millions vulnerable to preventable and treatable diseases. The mismatch also underscores a structural inequity in global health financing, where needs are highest but investment is lowest. More than 90% of medicine and 99% of vaccine used in Africa are imported. This means that even essential public health emergency program depends heavily on foreign production and supply chains. We saw that during COVID-19 pandemics, where dependency exposes the continent to shortages, delays, and inflated costs. Without local innovation and production, Africa will continue to react to crises instead of driving solutions. Strengthening research, domestic research and development and manufacturing capacities is not just a health goal, it's a strategic and economic imperative for the continent's future. Health security is the foundation of sovereignty. Investing in research and development links to Africa's priorities ensures locally driven solutions to emerging health threats, so Africa can detect, respond to, and contain outbreaks without relying on external supply chains. This is about proactive resilience, not reactive aid. The big threats, HIV, TB, and malaria, still accounts for millions of preventable deaths each year in Africa. A Made in Africa research and development ecosystem accelerates the development of vaccines, therapeutics, and diagnoses tailored to African population. Sustained investment and regional collaboration can shift Africa from being the epicenter of disease to the engine of innovation against it. As lifestyles changes and demographics evolve, non-communicable diseases such as diabetes, hypertension, cancer are rising sharply. At the same time, maternal and child mortality remain unacceptably high in some parts of our continent. Prioritizing research and development for non-communicable diseases, maternal and child health strengthens primary care, prevention, and innovation, ensuring no population is left behind as Africa modernizes its health system. The African Union targets to locally produce 60% of vaccine and health products by 2040 is both a health and economic goal. Scaling up local manufacturing will reduce dependency on imports, create skills jobs, and retain value within the continent. This shift demands not just factories, but R&D-led industrial capacities that links innovation to products and access. The African Medical Agency, AMA, is a game changer for aligning regulatory systems across countries. A harmonized framework allows faster approval and distribution of new health technology across the continent. Coupled with investment in talent development and research training, this ensures that Africa's best minds can innovate, regulate, and compete globally. The health system security, the big threes, meaning HIV, TB, and malaria, the non-communicable diseases and mother and child health, local manufacturing and talent regulation forms the strategic backbone of the sovereign Africa R&D ecosystem. Together, they define a vision where innovation drives both health security and economic transformation, anchoring Africa's future in its own scientific strength. The Made in Africa research and development ecosystem will succeed only when leadership, financing, and governance works in concert, turning policy declaration into functioning institution and tangible outcome.